You know, you brought a very good point about I'm going to see the doctor about screening. So, of course, in my field of prostate cancer, we encourage people to go get their PSAs.
Right.
This is a good time if you're a 50-year-old to go and talk to the doctor, have a conversation, and see if you should have your PSA. Make sure that you get digital rectal exam. 15% of prostate cancers are found by finding some sort of firmness or a nodule. But certainly, and if you're at high risk, if you have family history of prostate cancer, you may actually want to do it even earlier, and that's a discussion with your doctor. Colonoscopy saves lives.
Yes, so colonoscopy should start at the age of 50. And then actually, nowadays, you don't need to go for possibly even 10 years for the second one. So there was a time when we were doing it every 3 years and every 5 years. So about 5 to 10 years would be the second one, depending on what they find. But again, if you have a family history or other issues if they found things on your prior colonoscopies, then you may have to go more frequently. But that's the general screening rule starting at the age of 50. And mammograms, for most people, are at the age of 40. We're starting screening. If you're high risk or you have a family history, you may need to start earlier. And again, that's a discussion to have with your doctor. And then also pap smears. So for women between 21 and 29, you would do a pap smear every 3 years, and then starting at the age of 30, they would do it yearly, and then periodically test for HPV.
If you start, this is a question that just came to my mind. If you start sexually being active at an earlier age, is there a time change as far as the pap smear, or that's not?
I think that they may start at the age of 18, but again, I think that's a discussion that is best had with your doctors. And I think a really important discussion to have if you're a mother of girls is to consider the HPV vaccine. I know there are some controversies surrounding it with potential side effects, but I think that it's an important vaccination for our kids, because HPV obviously is the biggest risk factor for developing cervical cancer.
That's a very good point. So